For Brittany Goyette, home is where her Chihuahua Charlie is.
So this is Charlie. That can be like a little bit difficult at times, is traveling with a pet.
Goyette and her 10-year-old pup are Northern California natives, but Goyette's job temporarily landed them in San Diego.
And he loves it here as well. He loves running down by the bay.
The view from Goyette's rental is a reprieve after 12-hour shifts at Sharp Chula Vista Medical Center. That's where the licensed ICU nurse helps fill staffing needs, especially during COVID-19. Travel nurses like Goyette are supporting hospitals across San Diego and the country as the pandemic is filling up wards at a rapid rate. They're not from the communities they serve, but become part of them. Goyette has held the hands of patients during some of their toughest moments and when families can't be there.
We try to get everyone there, and like one of the hardest things is seeing patients pass away without their family there. Sorry. See, I'll still cry.
The tears came even as she remembered some of her patients while sitting miles away from the hospital. The death of an elderly man months ago still sticks with her.
Really just one of those charismatic people that like you meet him and you're just like, oh, I really like this guy.
He was in the hospital sick with COVID-19. His wife was too, and just down the hall. They were both near their final treatment options, but he declined anything more and asked only for comfort care. Goyette says she gave him pain medication and held his hand.
The only thing I could think of to do was say a prayer for him out loud. Sorry. And that was hard. Because I asked him if he'd like me to pray for him, and he said yes. So I said, "In Our Father." I had to pause like every 3 words. It was really hard just to watch him.
His sons made it before he died, but his wife was too unstable to transport even just down the hall.
Unfortunately, we weren't able to get him to see his wife. That was also really tough. We ended up taking him to her afterwards so she could say goodbye per her request.
The pandemic has created more demand for highly qualified ICU nurses like Goyette. Sharp Chula Vista Director of Critical Care Services, Danisha Jenkins, says the state mandates 1 ICU nurse for every 2 ICU patients.
If we are getting to the point where we're having to go beyond that, then that becomes a very challenging situation to manage.
She says the state allowed flexibility during the emergency because ICU nurses are a limited resource. They pulled staff from sister facilities, but Jenkins says they also heavily relied on skilled travel clinicians to maintain their nursing community.
You're tracking your ratio daily?
Hourly.
No? Good.
Because COVID doesn't care about ratios. In a video diary for KPBS, Goyette recalled that day's 12-hour shift when she tended to only 1 patient.
We do that often with a lot of our COVID patients if they're requiring to be manually proned, is what we call it.
It took Goyette and 4 other gowned-up colleagues to flip her sedated patient and improve their oxygen flow.
We usually leave them on their back for a couple hours if they tolerate it, but my patient didn't.
She needed her colleagues back quickly, but they were already down the hall turning another patient.
And then I had to find a whole new group of people to come flip my patient while another patient wasn't doing well. So needless to say, it was a pretty busy day, a little bit hectic.
Travel nurses can help make hectic days manageable. Jenkins says Sharp works to retain its top travel clinicians so patients continue to see familiar faces, especially behind the heavy safety gear they must wear. But supporting them can be draining on core staff.
Because they're having to orient people every single day to our area, our processes, how we're doing this.
But it pays off. Jenkins says travel nurses often refer friends, and Sharp just extended its contract with Goyette. That means she and Charlie will spend Halloween, Thanksgiving, and the holidays through January in sunny San Diego.
So I don't feel like you ever feel like this isn't my community, because in the end, this is like another human, this is another soul, it's another life, that I don't need to be part of your community to make sure I do my best job that I can.
And that job has many bright spots. While more than 800 San Diegans have died in the county, thousands have survived.
To see anyone get extubated, honestly, and like do well or get recovered to where they're moving out of the unit, you feel really proud and just like happy that like you got them there.
And they all leave a mark on Goyette. She remembered one recovered COVID patient the day he was going home. But he was leaving Sharp Chula Vista before his wife, another ICU COVID patient. The wife he was leaving behind also had dementia.
So I was like, well, why not like bring him up here? He already has COVID. She has COVID. Like, he should see his wife.
That time, it was for life, not loss, that she reunited a husband and wife. Taryn Mento, KPBS News.